Hello, and welcome to Surgery Squad's Retinal Detachment Surgery. I'm Dr. Jeff, and I will be guiding you through this procedure today. The retina is located in the back of your eye. When we see, light enters the eye. It is focused onto the retina, which acts like the film in a camera, feeding information to the optic nerve, allowing you to see. As you get older, the vitreal fluid, which is the gel in your eye, can contract, pulling the retina away from the eye. This contraction can cause a small tear in the retina, allowing the fluid to seep behind the retina, detaching it from the back of the eye. This can cause loss of vision. A retinal detachment is a very serious ailment that must be dealt with as soon as possible after discovery. Symptoms that you may experience with a detached retina include seeing floaters or frequent flashes of light, shadows appearing in your peripheral or side vision, a gray curtain moving across your field of vision, or a sudden decrease in your vision. Again, if you experience any of these symptoms, contact your eye doctor immediately. Today, we're going to perform a retinal reattachment called a pneumatic retinopesky. The surgery takes about an hour and can be done on an outpatient basis. Our patient today is a 30-year-old man who recently noticed flashes in his vision. His ophthalmologist dilated the eye and detected a retinal tear and a detachment. He recommended immediate surgery to limit additional loss of vision. Let's begin. First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put him to sleep. Can you place the needle for me? Just prior to surgery, additional drops of anesthetic are applied. We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please. Now that the patient is anesthetized, we insert a syringe into the eye. Now we inject an air bubble into the vitreal fluid. As the bubble expands, it pushes the retina back against the wall of the eye. With the retina back in place, we can now seal the tear using a freezing probe. The probe is touched to the outside of the eye where the tear is. This freezes the tear back in place. It may take several touches depending on the size of the tear. The tear is now repaired. The needle insertion will heal quickly. Can you remove the speculum? Our patient needs someone to drive him home after the surgery, and he shouldn't drive until he regains sight in the eye. We'll prescribe medicated eye drops to use several times each day for a few weeks after the surgery, and he'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses also need to be worn to protect his eye from sunlight and other bright light as his eye recovers. However, the biggest part of the recovery is head positioning. The bubble floats to the top of the eye, so the head must be positioned to keep the bubble against the detached portion of the eye. This means the patient must keep his head facing down, or the position indicated by his surgeon, for at least a week. Sight returns slowly to the eye over several months as the bubble must dissolve and be replaced by vitreal fluid. However, once the bubble dissolves, vision is usually restored to close to the previous level. You did a great job today, surgeon. While you're here, try one of our other surgeries here at surgerysquad.com.
Hello, and welcome to Surgery Squad's virtual teeth whitening. I'm Dr. Susie, and I'll be guiding you through this procedure today. You no longer have to be a supermodel or a movie star to have a dazzling white smile. Just about anyone nowadays can get one. A whiter smile looks healthy, plus it can improve your overall appearance and self-confidence. Our teeth become stained from coffee, tea, and other dark-colored liquids, and smoking certainly adds to the discoloration. A teeth whitening procedure can remove those stains caused by age and the things that we eat and drink. There are a variety of ways to do it: a whitening toothpaste or rinse, over-the-counter strips and gels, tray-based whiteners, or in-office whitening performed by a dentist. While the most obvious benefit is a brighter, whiter smile, you do need to know that whitening is not permanent, and a whitening program, whether you do it yourself or have it done by a dentist, might not always lead to the results you want. If you have the whitening performed by a dentist, your teeth need to be in pretty good condition. Your dentist will also want to fill any cavities or replace older fillings before the procedure. In addition, a dentist will not perform the procedure if you have gum disease or your teeth have worn enamel. If you already have crowns or other restorations, the whitening will be inconsistent between those teeth and the others. Our patient today is a 27-year-old woman who has opted for an in-office dental whitening. She's a tremendous admirer of coffee, but she wants to impress the folks at her 10-year class reunion with a bright, white smile. So let's scrub up, glove up, and help her out. Our hygienist has already cleaned her teeth to remove all of the plaque. So let's start by matching our patient's current tooth shade with one from our shade reference guide. Okay, we've got our starting shade. Let's see if we can make them more like this. First, protect her lips and tongue by covering them with these rubber guards. Nice work! Now we need to cover her gums and papilla, which are the tips of her gums between her teeth, with a special coating to protect them from the risk of chemical burns when we use the bleaching agent. Now, let's mix up our bleaching agent. We'll use carbamide peroxide, which is a powerful, reddish-looking substance. It turns into a stronger form of hydrogen peroxide in the mouth once we clean it off with water. That's when it takes off the stains. The mixture is ready, so let's get it onto her teeth. Cover each tooth evenly. We keep this solution on her teeth for about a half an hour. Let's see what kind of beautiful smiles underneath all of this red stuff. Take some water and gently wash away the carbamide peroxide. Now with our dental pick, simply pop the protective coating from her gums. Great work! I'll take off the rubber lip and tongue protectors and see you back out in the waiting room. She's really gonna knock 'em dead with that bright smile of hers at her class reunion. But for now, her teeth will probably be sensitive for a few days. She should avoid extremely hot or cold beverages for the rest of the day and use a toothpaste made for sensitive teeth for a couple of weeks. She should also, as much as possible, avoid discoloring beverages like coffee, colas, or red wine for a few days. If she smokes, well, now would be a perfect time to stop. This bleaching will most likely last for 2 or 3 years, so she'll want to make this an ongoing part of her overall dental care. She should call her dentist if she feels a burning sensation in her gums or on her teeth that lasts for a couple of days, or if her teeth remain highly sensitive. You did a fantastic job today. While you're here, try your hand at one of our other surgeries available at surgerysquad.com.